And to the rising cost of health insurance, which appears to be surging once again. A new survey of businesses found that annual premiums for a family of four climbed to $15,000 this year. The Kaiser Family Foundation, which releases the annual survey of employer-paid insurance, reported an increase of 9%, up from 3% last year. The report also documented a dramatic decade-long rise for both employers and employees. Annual employee contributions now total more than $4,100 on average. That is more than 130% higher than back in 2000. The survey also found that to cut costs, more employers are enrolling in high deductible policies that cut annual premiums but require employees to pay more out of pocket for medical care. We're here to tell us more about all of this is Susan Dentzer. She's the editor-in-chief of the journal Health Affairs and an analyst for the NewsHour. Susan, it's good to see you and have you with us again.
Great to be here, Judy.
So let's start with a clarification. We're saying that the premiums that employers pay went up 9% in the last year. Does that mean that employees are paying that much more?
Well, actually what went up was the total cost of an employer's health coverage package for an employee. So all of that went up 9%. We know that, as you said, on average, many employees will be paying only about $4,000 or so toward that $15,000 cost in effect of the coverage package. For about 50% of American workers who have employer coverage, they are paying 50% of the amount of the coverage. So, and actually what we see in the most recent year is that employers were picking up more of that cost increase than employees in this particular year. That's not always the case, but it was the case this year.
So what's behind the increase?
Well, there are lots of things that go into this steaming cauldron of higher health costs. One issue clearly is that we just have more chronic disease. Chronic disease cost is driving about 75% of our total health spending as a country. We have now lots of diabetes, lots of cancers that are now considered increasingly a chronic disease. And of course, the biggest one is cardiovascular disease. We know that we pay more than other countries in terms of prices for health care. So that's causing some of the increase. And in fact, there was an increment in drug price inflation that fed into the price increases this year. Underlying healthcare costs are a big share of this. Now, there's some effect from higher health insurance premiums, but it's not the biggest driver. And the clearest way you can see this is if you think about large employers in particular, most large employers who are employing 200 people or more don't usually buy insurance technically for their workers. They pay those health costs out of their own pockets. They're what's called self-insured. Well, their costs are going up just as fast as those costs of people who actually have insurance policies. So that's what tells you that it's really not insurance that is driving most of this increase right now. It's really the underlying costs of health care and health spending.
And as we mentioned, it's part of a trend. We're seeing it go up over the last decade. So it's not new, but it just seems to be a big increase in 1 year.
There clearly was a big increase, and we've had a couple of years where the increases have been much more moderate. Now, it should also be said, though, that there are lots of signs on the horizon that there's downward pressure on health spending and on insurance. For example, the White House has pointed out that the Federal Employees Health Benefits Plan, which covers about 8 million federal employees and their dependents, their costs for the next year are only going to go up about 3.8%. So we're seeing a kind of a mix of signals. This Kaiser survey is looking back over the last year. When we look forward, we see some downward pressure on health spending that could actually be quite beneficial.
And when you see this notion that almost a third of covered workers now in high deductible plans, that increasingly employers are saying, okay, you know, your premium may be less, but you're going to have to pay more for an individual treatment that you get.
Well, actually, in many circumstances, it's the employees themselves opting for those high deductible plans. And for a very simple reason, they cost less. The premiums are lower for them than more comprehensive coverage. And for 17% of covered workers, they actually have not only a high deductible plan, they have a health savings account or something like that associated with it. so they can actually put dollars aside to pay for health expenditures. So in some instances, it's very much the employee deciding, hey, I can get a break on my health insurance costs by going into these policies. Why not take it?
So I hear what you're saying about why all this is happening. And of course, there's political noise today as well. Republicans are out there saying, well, aha, this is connected to the Obama administration's new health care law. The White House is saying, no, that it has something to do altogether with pricing. And I mean, how much is the new health care law a factor, or is it?
It's a minimal factor. Again, if you look at just the insurance piece of it, one clear thing that we know has happened in the past years, that 2.3 million more young adults are now covered. And they got coverage through their families, their parents' insurance plans typically, because of a specific provision in the Affordable Care Act, which now enables individuals who are not offered an employer coverage themselves, young adults, can actually stay on their parents' policies up to the age of 26. So we know that that was one clear impact of the Affordable Care Act. However, young adults are some of the cheapest people to insure. So that
because they're healthy.
Because they're relatively speaking healthy.
Yeah.
So that could not really have driven the cost increase. Best guess is maybe 1 or 2 percentage points of this 9% increment was possibly due to the Affordable Care Act. But more likely, it's these other factors that are driving the situation.
Just quickly, Susan, all this takes place with the backdrop of the idea that there are less overall employer-sponsored health care coverage, that is less and less a part of the health insurance picture, that fewer employers want to do that. It's my understanding that's a trend that's taking place, even as we focus today on the cost of employer-sponsored care.
That has been
insurance.
A long-term trend, especially for small companies. If you're working in a company that has 200 or more employees, about 97 to 99% of those firms continue to offer health insurance. If you drop down to very small companies, 3 employees, 9 employees, that coverage clearly has been eroding. And actually, interestingly, last year in the same survey, there was a big uptick of coverage that seemed unexplainable. Now that's disappeared, and now we see again coverage for those smaller firms has been eroding. Now we are several years away from the full implementation of the Affordable Care Act, so we'll have to see what happens when subsidies begin to kick in and other things take effect to broaden insurance coverage.
Well, a lot of factors at play, and we're just glad we have you here to help us understand it. Susan Dentzer, thanks very much.
Thank you, Judy.